Dr. Perlmutter, when you first heard about Horizon Services, were you as shocked as most people?
Yes, I was shocked because as radiation oncologists, we're used to using huge machines in very large facilities with a lot of lead shielding, et cetera, et cetera. It never really occurred to me or to most that this could be done on a mobile basis, but it can for superficial tumors.
What is the biggest advantage here for the patients?
Well, it's convenience. Um, Convenience, for some it's beyond convenience because if they have disabilities, physical disabilities, sometimes cognitive disabilities, it's really hard to go to a radiation therapy center, every day for 3 or 4 weeks. Um, some can't afford it, they don't have anybody to drive them. But basically, if a person is in a wheelchair, or even a little beyond a wheelchair, we just bring them right up to the truck in that same wheelchair. We have a little lift and elevator that takes them up into the unit. They just basically sit in their own wheelchair for the entire treatment and then go back. And, we just come right to their house or nursing home or ALF.
What is the biggest response you get from them, people when they even hear about this, and even family members who might have to be driving them to and from cancer centers?
Yeah, I know family members are very happy. They're very pleased with the convenience and I mean, we often see tumors that have been left for a long time that are, very large and bleeding and draining simply because patients, their families have been scared to have surgery, and either they've never heard of radiation or they're not really able, they can't see how they could get the person to and from a radiation therapy center. So when they hear about this, they're very pleased, yes.
And the results are just as effective as surgery?
Overall, they're just as effective, yes, yes.
Do you have patients that you can't treat on the truck?
The simple answer is no. I mean, as long as they're compliant, yes, there is an occasional patient who is not compliant. I mean, obviously they have to hold still in a working in the face and head region. In a typical radiation facility, they will have a restraint, an aquaplast mask. That's for everyone, okay? And we don't do that. So they have to be, ready, willing, and able to hold still. That's the only type of case that we can't treat.
And most are.
Oh yeah, most are.
Most are treated, and
Yes.
life goes on with the least disruption in their day.
Yeah, that's correct. That's correct. We have many patients who are on the younger side. I mean, in this day and age, on the younger side can be in their 60s and 70s. So it's a pretty wide range.